Hope in a syringe. I'm Adrienne Pedersen today on Up Front. The new COVID-19 vaccine is here with more on the way. Next, cases trending downward in Wisconsin. I'll ask a top doctor if it's possibly the beginning of the end. Then Congressman Mark Pocan on the new COVID relief deal coming together in Washington.
This shouldn't be a partisan issue. Helping people during a 100-year pandemic should be a no-brainer for any elected official.
Plus,
thank you for your service.
They protected us. How the U.S. will now protect veterans from COVID-19.
Taking on the issues important to Wisconsin. This is Up Front with your host, Adrienne Pedersen.
Wisconsin healthcare workers are getting the new Pfizer COVID-19 vaccine. Hospitals are carefully storing the vaccine and giving the shots to their employees about a month apart. The FDA has just given the second coronavirus vaccine created by Moderna a green light. And there's more encouraging news. COVID cases in Wisconsin seem to be decelerating. A much feared spike in cases post-Thanksgiving didn't really happen. We're talking about all of this today with Dr. John Raymond, President and CEO of the Medical College of Wisconsin. And it's always so good to have you here with us, Dr. Raymond. You know, like I said, we didn't really see that surge we all feared after Thanksgiving. So what do you think that says in terms of Christmas? Is it safe then to go about our Christmas plans?
Yeah, thanks, Adrienne. Really important question. No, it's not safe to let down your guard. People still need to practice the 3 W's. Watch your distance, wash your hands, and wear a mask, and limit the number of interactions they have with people outside of their home. So you are right, the pandemic is decelerating here in Wisconsin, but we still have many more cases now than we had even during the first and second surges in the spring and the summer. And what happens after you have a big surge, normally people start to behave a little differently, maybe be more cautious, and that people that can be infected probably have at that time. And then you start to see it tapering off. But just to put things in perspective, we still have well over 1,000 people in Wisconsin hospitals with COVID-19 and more than 300 in our ICUs. The ICUs in the hospitals are above their normal censuses, but better than we were maybe 5 or 6 weeks ago. What we also know is that the majority of spread still is happening in small family gatherings and during leisure time activities, and those remain the highest risk. So for Christmas, things probably need to be a little bit different this year, same for New Year's. But we do have the hope of these vaccines, I think, that'll help us have a better 2021.
We're all hoping for that. The case positivity rate still isn't good in the state at more than 30%. I know officials say they want to get us below 5%, but like we said, the number of cases is going down. So do you think we're turning some kind of corner here?
I think it's fair to say that we're not in as bad a shape as we were a month ago. I think it's probably premature to say that we've turned a corner because we really have to see people continuing to be responsible about protecting themselves, their families, and their communities until we have the vaccine broadly available for our population. That's probably not going to happen until the spring, maybe even the early summer of 2021. So even though our case counts are going down, hospitalizations are going down, we still have a lot of cases, and we're close to our peak in terms of the number of deaths we're having. Every day, we're close to 50 a day in Wisconsin. And again, to go back to the summer, we were having single-digit deaths in the state, and many days it was 5 or 6 people, and now 50 a day is just too many.
I remember when a doctor told me months ago that we would eventually get to more than 1,000 cases a day, and that was hard to believe, and look where we are now. So the vaccine is really starting to roll out slowly here in the state. That's something that we've noticed over the last few days. This is not a fast process, and the governor has now come out and said they're not getting the amount of Pfizer vaccine doses that they thought, closer to 35,000 instead of 50,000. Those two things combined, is this pushing back the timeline for the general population, you think, to get the vaccine?
I don't think so. It's not surprising that in the first few weeks, that things maybe aren't as coordinated as we would have liked them to be. I know that the Department of Health Services is working very diligently to beef up the coordination, and I trust that that's going to happen within the next few weeks. One of the issues with the Pfizer vaccine and with the Moderna vaccine that was authorized, or was at least given the green light today for CDC to evaluate, these are relatively new technologies, about 20 years old. And there's no real manufacturing capacity because none of this type of vaccine has been broadly marketed in the past. So even though the vaccines appear to be very safe and very effective, our manufacturing capacity has to scale up, and you can't just contract with someone who's done this before. So these two companies are sort of pioneering how you ramp up the production and distribution, and that's a bit of a challenge. What we would hope would happen is that other vaccines will come to market in January or February. I'm very optimistic that the AstraZeneca vaccine and maybe the Johnson & Johnson vaccines will come to market. If those two come to market, they're using a more traditional technology with a lot of manufacturing capacity. If they come to market, there'll be very, very rapid deployment in the whole population.
So it could be 2 vaccines, but it sounds like maybe in the future we could have 4 different vaccines. What does that do in terms of speed of getting that out to people? Does that push up this, late summer, early fall that we've been hearing from state health officials? Do you think we could get that sooner if we get more vaccines out there?
We could, certainly. And again, the Pfizer and Johnson & Johnson have significant manufacturing capabilities, and they can contract with others that can make their vaccine quickly. So if those come to market, I would certainly push up the date closer by a couple of months at least when we can vaccinate the entire population. The Moderna and Pfizer have estimated that they will not have enough doses to vaccinate the entire U.S. population in 2021. So we really need some of these other vaccines to come to market. Now, I mentioned 4. There's another American company called Novavax that's very close to having approval in Europe. And if they do get approved there, I would hope that very rapidly they would apply for approval here in the U.S. So there might even be a 5th vaccine available to us in early 2021.
But even with all these potential vaccines available, I know you get questions a lot. You do these briefings where the public can join in and ask you anything they want. How do you think vaccine hesitancy is right now? Because I've heard from people say they're not ready to do this even when it is available.
Yeah, I think that's understandable. There are many people that might be reluctant to take the vaccine because it was developed so quickly. Both of these vaccines were developed in about 10 months, and normally it takes 12 years to develop a vaccine. On the other hand, COVID-19 is a very serious pathogen. It's caused a lot of damage to our health and well-being and our economy. And these vaccines are our best way out. The public should be assured that these are very safe and effective vaccines. And I would hope that that really is overcome in the next few months. And there actually are some more recent polls showing that people are becoming more willing to take the vaccines.
Well, Dr. Raymond, we always love having you on the show. Thank you for your time.
Thanks, Adrienne.
Millions of Americans stand to lose government COVID relief money at the end of the year. Next, Democratic Congressman Mark Pocan on the deal being hammered out in Washington. And later, Giannis's new Supermax contract is good for him, but it's also good for the city.